So, Dr. Davidiuk, thank you so much for joining us for the Drive for Men's Health. You're part of the team now. And as you know, this is our 5th year driving for men's health. We're trying to get men to live much more healthy, active lifestyles. And you actually are a urologist, just like I am.
Correct.
How is it? You like it?
I love it. New to the field as far as over the past 6 years, but it's been great, learning a bunch. I think part of being a doctor is just learning over time, so it's been great and excited about more to come.
So you used to be on a different field previously, in your previous life.
Right. I used to have a different life. I played baseball growing up and I got a chance to play professionally. And so I took an opportunity to play for a couple years in the minor leagues where I got to play professionally and enjoy that before deciding maybe I'd return back to medicine.
Yeah. But that's interesting. So what led to that shift, like to get back into medicine?
I always thought medicine would be the field that I would take, I didn't think I was good enough for baseball, and I got drafted, and I actually thought maybe let me give this a shot and pursue this dream and see if I can make money playing a game as opposed to working hard for the money. And looking back, I think it was an incredible opportunity. It taught me how much I wanted to be a doctor.
Mm-hmm.
Missing that opportunity. Baseball was a great game, but despite that, there was always a calling in my life to be a doctor, and so it brought me back after a couple of years.
Yeah, that's awesome, man. So you actually specialize in a lot of things in urology. One of the big things is your prostate and overall prostate health. So what are some things that guys need to be looking out for when it comes to their prostate health?
I think one of the frustrations guys always ask is, why do we even have a prostate? It helps with fertility when we're younger. Later, it just causes problems. I think two of the problems that I see most are voiding problems and then cancer problems. You can see behind us kind of where the prostate fits. It just sits right below the bladder. It's about a walnut size, but it does grow continuously as we age. The growth will sometimes block urine from coming out easily. There's things we can do as doctors, medication-wise and surgery-wise, that help prevent that from causing a decrease in quality of life. But in the same sense, cancer can grow in prostate. I do a lot of robotic surgery, so prostate cancer becomes a concern as gentlemen get older. We do prostate screening with PSA. That's been controversial, but new changes show that PSA screening does help as far as decreased mortality from prostate cancer. I think the important thing for you and I is to make sure we talk to patients about the pluses and minuses of prostate screening. A new tool that we've developed is the prostate MRI. Mm-hmm. We're able to see prostate cancer now when it's aggressive and high grade about 85 to 90% of the time. So we can see a nodule there, and rather than doing a random blind biopsy like we've done before, we can target the biopsy. This lets us find the high grade aggressive cancers we need to find without biopsying and finding low grade cancers that maybe patients who will live with and not die from. Mm-hmm. So that's been a nice advance recently we've been doing a lot of here
That's
at
pretty
Orlando
cool.
Health.
I've actually seen how they're done, and usually guys I think get an MRI and then they come to you and get what we call a fusion biopsy. So that would be if there's a concern on a PSA. So a lot of young guys watching right now, when should they start getting that PSA checked?
I think it depends a little bit on your risk factors. We're still learning a lot about prostate cancer. The biggest risk factors are a first-degree relative, a father or a brother with prostate cancer history. And then race does play a role. African American men have a higher risk of prostate cancer. The other thing that plays a role is everybody's different about prevention.
Yeah.
Some oncology screening guidelines say you can start PSA screening at 40. If your PSA is incredibly low, you can defer screening additionally until 55 when AUA recommends. There's no family history and there's no concern and there's no anxiety about prostate cancer. I think waiting until 50 or 55 is reasonable as well.
The cool thing is you don't have to worry about this stuff, because if you go see a physician at least once a year, whether you're a primary care doctor or your specialist, they'll kind of do all the thinking for you. Now, let's say they have IPSA and then they need the biopsy. Can you show us like exactly how it's done? Because a lot of guys always ask, like, this biopsy you're talking about, how is it done? Is it robotically? What is this fusion thing? So just to kind of simplify it, how would it be done based on this?
So again, the prostate is deep down in the pelvis under the bladder, but it sits right next to the rectum. This is where stool will exit the body. It's where we do our rectal exams. Prostate cancer grows in the back of the prostate about 80% of the time. We often feel for nodules. The probe, the ultrasound probe, does fit in there against the prostate, and through the probe we're able to numb the prostate for biopsies as well as perform the prostate biopsy. If we do a urinav biopsy, we're able to see the lesion by fusing the MRI with the ultrasound and we can target that lesion as well.
Okay. So and once you've been diagnosed, there's lots of treatment options. And I think one of the treatment options that's grown now is just kind of watching the cancer, which I think is pretty cool.
Right. Active surveillance is what Jamin's talking about, and I think that's a way to avoid the side effects of treatment. A lot of prostate cancer may be low grade or low risk, and when I talk about low risk, I tell patients not likely to spread. We want to make sure it's not more aggressive, so we watch it closely. We often repeat PSAs every 3 months. We'll biopsy or get an MRI additionally in a year, and make sure that the cancer is not worse than originally diagnosed and not growing or changing. But for men with low-risk disease, I always start with active surveillance because I think those cancers may not need to be treated.
Yeah. So if you could give guys 3 tips out there before they can have the time and get in to come see us, what can they start doing today to have a better prostate in the future?
So I think prostate health is something that we need to focus on as physicians. I think the biggest thing is prostate health. Number 1 is keeping a good body weight. I think metabolic syndrome affects us in ways that we're not even fully understanding. I think high acid levels in the body, as well as free radicals, are something that we talk about in health. Can cause inflammation, can raise PSA, cause angst regarding that, in addition to just not feeling that well. I think daily exercise is another thing we can do. I talk to all my patients about 30 minutes of exercise daily, from as simple as walking your dog, taking a bike ride, enjoying a stroll with a significant other. It's proven to increase energy, help with testosterone, as well as I think help with prostate health. I think the other thing that we don't often do enough, especially in Florida with kidney stones, is drink enough water.
Yeah.
I think urinating often. I tell people if your urine is clear white, you're drinking enough water. If it has any yellow tinge, you're probably a little dehydrated. Another thing we can do to flush out our system, make sure there's no inflammation, and keep the prostate healthy.
Awesome. Well, thank you so much for your time today, Matt.
Hi, I'm Dr. AJDavidiuk, and it's time to drive for men's health.